and welcome back to Dr. Brandy's Pearls. This is officially show number 1. So, this is a little bit about holistic health, and this is for nurse practitioners as well as patients to listen to and understand, to help on both sides advocating for the patient and the patient to advocate for themselves. I want to talk about how it is so important to make sure that we complement all 3 aspects of a patient. And a patient, you make sure that all 3 aspects of yourself are being identified when you are meeting with your medical professional or medical provider. And those 3 elements would be mind, body, and soul, or spirit. And I'm not really talking about spirit or soul based on a religious level, but more just a spiritual healing level. Because we have to understand that we have so many complicated parts about ourselves that make up who we are, that we have to make sure that we're healing all of those things in order for our bodies to be able to be healed. So let's talk about the first part. Our mind, our mental, our focus. Let's be clear, everyone. We know that even within ourselves, that if our mind is not focused and we're not feeling like we're balanced or sane, we're not going to do most of the things that someone tells us. We're better yet, we're not even going to be listening to it. Most of what they're saying to us means nothing at that point. And it's going to go in one ear and right on out the other. So, as a provider, I encourage you to make sure that your patient's mind is where it needs to be. Doesn't mean that they're crazy, doesn't mean that they have mental health issues, doesn't mean any of those things. Just means that they might be preoccupied with other things that are not associated with their health. You know, they can have so many personal issues going on that taking care of themselves is like the last mind. But it could be they found out something about their health and now their mind is not really focused on what it is that they need to do in order to move forward. And that can be very, very detrimental in how they move forward and whether or not they're going to be able to do what they need to do or even hear the plan that is put in front of them in order to make sure that they're healthier. So let's talk about that. How do we approach that? How do we do those things? As a provider, you need to start utilizing that as one of your first questions that you talk to your patient about. We're so busy trying to figure out what's going on with them physically. Let's ask about their mental health. You know, it's not about filling out a PHQ-9 to find out if someone's depressed or la 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 la. Because to be honest with you, a good bit of us are depressed at some point in time in our life. Whether it be for a day or 2 or it's months, we all have that moment. How about just asking the patient, how are you doing? And, generally, how are you feeling today? How have you been feeling over the last week? Have you had any problems communicating or concentrating on things? Just general questions to find out where their mind is. And once you know some of those things, it kind of helps you focus your visit. And patients, that helps you to let you know that your provider actually cares about you and actually is worried about you as a whole. They're not just worried about one aspect of you. And as nurse practitioners, we are one of the best people for you to see. Why? Because our goal, and has always been from the beginning of our education, is to focus on the whole person and not just one side of it. But as we progress in our training, sometimes it gets away from us, especially if we're in a busy practice and they're trying to throw hundreds of patients a month to us, and we're kind of like trying to balance everything out and remember everything about everybody. But we have to remember that if we want our patients to come back and see us, and we want them to remember us and think that we're great providers, we have to remember all parts of them. And this part is so important, and that's knowing how our patients are doing mentally. Remember, their focus has to be healthy. If it's not healthy, or we're not working on helping them figure out how to get to that point, they will not get better. they will not progress forward. They will not know how to handle the things that may be in front of them, especially related to their health, especially if it's not a good situation and we have a lot of work to do. We need them to be focused. We need to be sure that they understand that all of them matters to us, not just part of them. So let's keep that in mind when we're talking. And patients, keep that in mind when you're talking to your provider. Talk to them about how you feel, not just the physical things, but how you feel emotionally. You know, we can counsel you to an extent. You know, we don't have the full range to spend, a full session all the time, hour talking to you as if we were a counselor, but we are counselors. And if there's anything that's out of our range or out of our situation, our knowledge level, we will refer you out. And there's nothing wrong with counseling. There's nothing wrong with talking to somebody that totally is a stranger to you. Why? It's kind of better for you to do that, because that person can't judge you. They can't start monopolizing how you think and feel because they know all about your personal things or they know you so well. It's even better because they can give you a non-judgmental advice that can help progress you forward and move you forward and help you look at things from a different way, versus always having to talk about certain things to maybe a loved one or a friend, because sometimes those things, they kind of just, they're blocked out. It's hard for them to see the difference. Think about it. Your best friend or your girlfriend or your guy friend, and they know all your problems, they know all your issues, and they tell you, well, man, you shouldn't do this anymore. You should just leave that person alone, and and it may not even really be what you want to do. But this is the advice you're getting because they feel some type of way towards you, because they're protective of you, because they love you. They don't want to see you hurt. But it's not always about that. Sometimes we have challenges we must face, and we don't have any choice but to face them. And we need solid advice on how to move forward in those things and someone to support us in doing that. So remember, the mind is important. The mind also determines whether or not we're going to heal good, if we're going to heal fast, if we're going to follow regimens, if we're going to do things that we need to do. And we need to remember that for our patients as well. Our mind definitely balances out whether or not we're healthy or not. And if we always think we're sick, we're going to be sick. If we look at ourselves as healthy and we're trying to progress, we're always going to have that positive mind frame that I can do what I need to do in order to be where I need to be. And I can get to that positive level. And I can get healthier. I can build upon that. I want to get up and exercise. I want to get up and eat right. I want to make sure that I take this medication, or I utilize these natural properties to help me get better. All of it matters, So when we look at the body, we're not looking at the body as just a medical diagnosis. We're looking at the body as in what other aspects of this situation or this disease process is going to be affected. How can I truly, fully, holistically fix this patient or help this patient? Just because somebody has high blood pressure doesn't mean I'm only focused on your blood pressure. I need to find out, is there possibility of you having high cholesterol along with this? Is there a possibility of you having diabetes along with this? Is there a possibility that your eyes are going to start not working? Is there a possibility that you're going to have sexual dysfunction? Is it truly necessary for medication at this point? We have to think about all these things as providers and nurse practitioners, but as patients, you have to speak up for yourself too and think about all these things. If we start telling you all these different aspects of your health, and we're telling you these things can be and may be affected or already are affected, then you need to talk to us. Tell us what you think is going to help you be, how you move forward with taking care of the things that you need to get done. So I want you guys to think about all those things moving forward. When it comes to your body, your body is important. You have to work every aspect of your body. You can't just work a portion of your body. You can't just do part of your body. If I tell you, hey, you do have hypertension, and I tell you a few things you got to do, but you can't look at it like, well, she said all I need to do is eat less salt, eat less fat, and take these medications. No. Your goal should be 125% that you move forward and doing more than that. Moving forward I want to make sure that I'm monitoring my weight, making sure that I move forward, that everybody in my household and everywhere I go and everything I do reflects that I'm eating healthier or making better choices. I need to go ahead and have more water. Definitely. I know I need to go ahead and just make sure that my eyes are okay and that I monitor my skin. Different reasons, of course, for different things, but all of these things matter in your health. And whether you have hypertension or not, you could be a totally healthy person. But monitoring all these things about your body, in addition to the fact that you know you have something wrong, only makes things better for you in the long run and how you move forward. So now let's add in the spiritual side of it, or your soul, or how that goes back to an emotional thing too. And it's because mentally, we don't just feel a certain way mentally. We have an emotional or spiritual thing. What is it that your patient focus on? Are they religious? Are they spiritual? Do they meditate? Do they do yoga? Do they just go to church? Do they read a Bible? Do they practice rituals for healthy eating and healthy living and for stress and so forth? Those things are important. You need to ask those things as a provider and patients. You need to tell your provider in this aspect what you do, because now we can figure out how we can add all these things together to make sure that you have the best outcome possible. And when we're talking to you about things that we need you to do in order to make yourself better or do better, now we know what things we can actually refer to you for, or refer you out for, or even talk to or find other community resources that may benefit you in this. Also, it will help us to understand, like if you come back and you're updating us on things and we see that you've done a great job, maybe it's something that you're doing that will really help other patients, or maybe there's things you do in your spiritual way that might somehow hinder your progress as well. So we need to know about those things. We need to talk to these patients about these things. And as providers, we have to learn to become very much more knowledgeable about these types of things and these types of practices when it comes to health for many people. Because people have herbs that they like to take. They have healing ceremonies like yoga and meditation and tantra and certain types of massages, all these different aspects that they utilize in order to help balance them, not just mentally and physically, but spiritually. Because our spirit and how we feel on the inside, that has nothing that we cannot tangibly see, matter about how we move forward and how we progress in our health. Not just our daily life, but we do know that our daily life affects all those things as well. So, I've talked to a patient, and I think I've said this before in my Facebook group to several people. I talked to a patient who specifically has chronic pain. She's only 45. She specifically says she needs to go to another country that will look at her as a holistic patient, that will look at every aspect. She knows she's chronically depressed. She knows that her spirit is broken at this point because she feels like at this age she should not be in so much pain. And she is, and everybody wants to just throw medicine at her, and they're trying to find more diagnoses to throw more medicine, and that's not what she needs. She needs every aspect of her looked at. She needs every aspect of her figured out and help and monitored and put and progressed so that she can be able to handle the pain. It may never go away 100%, but can she handle it better if she's mentally where she needs to be? Can she handle it better because they've used spiritual or suggested spiritual options that feed her spiritually as far as how she manages her pain? We can't assume health is only medicine, because it's not. Medicine was not even an avenue billions of years ago. We use other ways. We use more natural options. So we have to start being open to this thing. We have to be knowledgeable. We have to start taking the time to figure these things out as a whole with our patients. And patients, you need to talk to us about it. Tell us about these different things. Sometimes people are just, not knowledgeable about these things. And if you have knowledge to give your provider, give them that information. Then let them continue to do research and see how they can truly utilize it for you and for others that come behind you. But we have to remember, we have to holistically holistically take care of our patient. We can't just do a portion of it. And the fact that our patients are feeling this way and they don't feel like sometimes they can talk to the providers about that, that's important. But I know as nurse practitioners, we tend to have our patients come to us because they do feel that they can have these conversations and get into detail. But I don't want you guys to get out of that, because many are getting around certain types of providers that are only medically diagnosis based kind of thing, and you're getting out of listening to the whole picture. And you need to get the whole picture. No, we don't have an hour for every patient. I mean, we can, but we don't. So with that being said, start putting together in your practice the right types of questions to ask your patient. Listen to them. Pay attention to what they're saying. Pay attention to their demeanor. Pay attention to how they seem to be when they're talking to you. Pay attention to the people that they bring with them to their appointments. Pay attention to just the small things that they tell you they got to go run and do, or they got to go take care of, because those things matter in whether or not they've even been listening to you the whole visit. Whether or not they're going to do the things that you told them to do when they leave. You know, patients do things, and sometimes, I got to do this. No, you don't have to do anything. But obviously there's an underlying thing. I have a patient that would tell me all the time, I'm telling her about her pressure and all that. She's a young lady, but she's like, I got to have my tequila. I got to have that. Baby, you can't have tequila like that. You can't drink tequila 4 days a week or 3 days a week, or drink a half a bottle or drink a whole bottle once or twice a week. It's going to affect your weight. It's going to affect your blood pressure. It's going to affect your mood. It's going to affect whether or not you're going to follow this regimen. But guess what? There's an underlying problem there, obviously. Because if you feel like you have to drink that often and that much, and you can't tear yourself away of it to care more about your heart, there's a problem, right? So we need to think about these things. We need to talk about these things with our patients. We need to move down this road with our patients and see what it is that, is progressing or causing a problem with them doing the things that they need to do in order to be healthy and survive and get past the emotional issues, get past the issues that are going to then be attached to knowing that they have a chronic illness. We have to understand these things. We really do. So talk to your patients. Know that they are a whole person, meaning that they're more than just the organs that are in their body. They're more than just some disease that we attach to them. They are much more than that. They are a person with emotions, with feelings, with family problems, with work problems, with this, that. I'm not going to take you off of work because you tell me you're stressed at work. I'm going to suggest things to do in order to reduce that stress so that you can move forward, and I find that to be something that a lot of patients do, but they need to find stress relievers. Stress relievers are important. We cannot allow people to suck us whole. And as providers, we can't allow that either, and patients tend to do that sometimes. You don't want the patient to come and just drop a load on you, and now you're worried. But you want to be able to ground yourself and balance yourself in your practice enough to know not to take what people tell you or their issues and so forth and lay it on you, on your spirit and on your heart and on your mind, so that you can't progress and now you're unhealthy. We have to be able to leave stuff where it is, but we still have to use our critical thinking skills and our people skills and our resources to help them. So tell me what you think. If you can, leave a message. Send an email to Dr. Brandy, FNPC, F is in Frank, N is in Nancy, P is in Paul, C is in cat @gmail.com. If you have a question or you have a comment, I'll be more than happy to add that to the next podcast and just readdress it. But if you have comments or questions, definitely send them out. But I need you guys to remember that this is a pearl for you as a patient as well as a nurse practitioner, to remember that we have patients that are a whole person. Holistic care means a lot, and it's not what it used to be. It used to be just minimal things, but now we have so many people who consider being healthy naturally is like almost a fad, but it's not. It's how we've always been. It's just we've started adding more potent options for our patients through medication, and that's great. But some of these medications are not meant for every patient, and every patient doesn't want to take a medication, and every patient doesn't want to be stuck on medication. So we have to wholeheartedly find different ways to help our patients with doing better in their healthcare options, and how we get them away from those things that they don't want to be a part of. Healed. They want to be cured of things. And no, we can't cure everything, but how they maneuver through the disease, how they deal with the disease, how their quality of life enhances versus decreases matters with how we manage this patient holistically. Remember those things. Remember that when you're talking to these patients. Some of these patients are going to come in here and be like, oh God, why? But there's a reason. There is something underlying there. No, we're not psychologists and psychiatrists and but we are very knowledgeable of those things. That is why we are what we are. That's why we learn the way that we learn as nurses as a whole. And we got to this level to be able to provide care to the point of being the actual head of a care team, because we have that knowledge. We have that skill. And many of us that get into this, not everybody, but most of us that get into this already have this intuitive healing nature about us. We already have this nature of people finding it calming to talk to us, and we're able to help people solve problems. We may not be always able to solve our own, but we are able to help others. So use it. And patients, I encourage you, especially if you have a nurse practitioner, which should be one of your first people that you should love to go and see. Talk to them. Give them what is going on with you as a holistic patient, and not just what your body is doing. Talk to them about it. Talk to them in detail about it and see what we can do to help you have the best quality of life possible. All we want to do is be free of as much disease as we can on this earth. And the only way to do that is being able to talk and communicate and truly listen to what the other person has to say about these things and how we can help them move forward. And I thank you for joining me for this podcast. The next one will be coming up in a couple of weeks, and it's going to be on a topic that I have started to become one of my favorite topics, and I've gotten to be pretty good at it and pretty knowledgeable. And it's going to be on sexual dysfunction, holistically speaking. Let's talk about it. You guys have a great week, and I'll see and healed. They want to be cured of things. And no, we can't cure everything, but how they maneuver through the disease, how they deal with the disease, how their quality of life enhances versus decreases matters with how we manage this patient holistically. Remember those things. Remember that when you're talking to these patients. Some of these patients are going to come in here and be like, oh God, why? But there's a reason. There is something underlying there. No, we're not psychologists and psychiatrists and but we are very knowledgeable of those things. That is why we are what we are. That's why we learn the way that we learn as nurses as a whole. And we got to this level to be able to provide care to the point of being the actual head of a care team, because we have that knowledge. We have that skill. And many of us that get into this, not everybody, but most of us that get into this already have this intuitive healing nature about us. We already have this nature of people finding it calming to talk to us, and we're able to help people solve problems. We may not be always able to solve our own, but we are able to help others. So use it. And patients, I encourage you, especially if you have a nurse practitioner, which should be one of your first people that you should love to go and see. Talk to them. Give them what is going on with you as a holistic patient, and not just what your body is doing. Talk to them about it. Talk to them in detail about it and see what we can do to help you have the best quality of life possible. All we want to do is be free of as much disease as we can on this earth. And the only way to do that is being able to talk and communicate and truly listen to what the other person has to say about these things and how we can help them move forward. One of my favorite topics, and I've gotten to be pretty good at it and pretty knowledgeable, and it's going to be on sexual dysfunction, holistically speaking. Let's talk about it. You guys have a great week, and I'll see and talk to you all very soon. Thank you for joining Dr. Brandy with Dr. Brandy's Pearls.